Welcome back to Underqualified, everybody. Thank you
Oh,
for joining us again in our virtual adjusted circumstances. Like we said in the last video, we are both back to school, which means Benjamin is thousands of miles away. Well,
you're in Texas where it's
1,000.
snowy and
Yep.
it's weird
Oh, it was 3 degrees
in
today
school.
here in Denver.
Really,
Yeah, it
it
was super
was
cold.
the real feel in Texas is like 10.
Fun.
And it's gonna get like legitimately down to 0 on Monday, and which is pretty unheard of.
Yeah, it's
And
crazy.
so, of course, everybody is stocking up down here like the world's ending for our 2-day snowstorm. I was at Target earlier today, and all the fresh produce gone. And I'm like, people, it's a weekend storm. Like you're gonna be okay.
But all of you who are watching at home are going to be watching this in I want to say April. So you don't care about this storm in
Mm-mm.
February. I was just looking at my calendar.
Um, we've got what I hope is going to be a really interesting episode for everybody. And we're going to talk about two massively different forms of therapy. Not for anything in particular. Mine is a type of cancer therapy, and Benjamin's is a type of mental therapy. Just
I
call it
guess,
that.
yeah,
Yeah.
yeah.
So I'm going to be talking about CAR T cell therapy, and Benjamin's going to be talking about music therapy a little bit later on, which is a topic that I actually did a research paper on when I was in college. It was a research paper about how there isn't enough research about music therapy. But I learned about CAR T cell therapy in my cancer biology class, my senior year in college. And before I dive into exactly what that is, I want to talk a little bit about just cancer in general, as well as some of the more stereotypical ways that we treat cancer. Um, and so the biggest misconception, I won't say across the board, but for myself, sort of growing up, because we always talk about fighting against cancer. You know, there's the March to End Cancer, or, you know, all of these charities about cancer. Stand Up to Cancer is the one that Major League Baseball does pretty regularly. And so, having never really done a class that focused on cancer, it's very easy to feel like cancer just sort of is. You know, it's a thing that you get in various regions and it's bad, but it's sort of the same thing every time, which is very much untrue. Um, Cancer develops from probably thousands of different avenues. And what it is genetic damage. And so it's genetic damage in really any tissue of your body. There's a reason that skin cancer is so common, and that's because our skin is exposed to UV radiation, and so it gets damaged. And those damages to your DNA over time can cause these errors that lead to your cells replicating way faster than they should. And we talked about this at the very beginning of my cancer biology class, how many times a normal cell would be able to duplicate itself before it's recycled by the body. Because for those of you who might not be aware, we get a complete new body's worth of cells every 7 to 15 years, depending on the estimate from wherever you're getting your sources. Because none of our cells are stagnant. The ones in our brain and in our bones and things of that nature are by far the most long-term. But even some of the tissues in our brain have turnover. And one of the reasons for that is to prevent this sort of genetic damage from happening. So that makes sense on a logical standpoint, because the more times you attempt to replicate the DNA in one given cell, the more likely you are to have a problem, right? So the more attempts that you put into the same situation, the more likely that something is to go wrong. And so if the body recycles the cells and stops them from replicating after a certain number of times, that is one of the ways that the body prevents cancer from developing. And so as we get older, those pathways of prevention wear down, which is why, with the exception of childhood cancer, which is something that I'm not going to talk about at this time because it's more of a genetic defect that those individuals are born with as opposed to developing over the course of their lifetime. That's why cancer tends to be a disease, not of the old, but of the older, if that makes sense. So it's a relatively new development in terms of the span of human history, because it used to be that humans simply did not reach an age where we would get cancer a lot of the time because there were other factors that would intervene. And so it's something that has really come on within the last 100 to 200 years. As the medical field has improved and people live longer lives, we start to reach this point where people develop this wide variety of illnesses that have sort of fallen under the umbrella term of cancer. And so what cancer is its uncontrolled replication of cells from some sort of genetic damage. Any cell really is susceptible to it. And there's various different forms of genetic damage that can make that happen. But once you are diagnosed with cancer, the most convenient and most beneficial, if you can catch it early enough, form of treatment is to simply take it out, which I think is not surprising to anyone. If you find a mass relatively early on and it hasn't spread anywhere else in the body, you can go in, scoop that out with a surgical procedure. You might have to do a little bit of chemotherapy if there's some concerns that it might have differentiated slightly beyond that. But by and large, that tends to be pretty effective. The problem that we run into is with these really aggressive cancers. So you hear about glioblastoma, breast cancer, pancreatic cancer, things of that nature that for whatever reason seem to grow really quickly, are really hard to remove, all of these other factors that lead to an increased mortality rate with those particular diagnoses. And so sort of the bleak perspective is that we really have not come up with a cancer treatment that works. And that sounds strange to say because we have all of these options that people are familiar with. So there's chemotherapy, immunotherapy has really taken off. And there is promise to immunotherapy, and CAR T cell is actually a form of immunotherapy. But prior to the development of immunotherapy, chemotherapy and radiation were really your only two options, separated from surgery. And both of those options, the goal is just hopefully to kill the cancer cells faster than you kill the patient, which is a really sort of dark thing to say, but that's the way that cancer drugs work. They're really hard on the body and they destroy cells. And so the goal with the chemotherapy drugs is that the patient will be able to survive, but they have all of those horrendous side effects. And you hope that in the meantime, the chemotherapy kills the cancer cells. And so my professor described the older forms of cancer treatment as hoping to keep the patient alive long enough that they die of something else, which is a really pessimistic view, because with so many medications and so many treatments that the medical world has come up with for all things that are not cancer, the goal is cure, right? We want to fix this so that people can go back to living their lives. But oftentimes the technology is just not there for cancer treatment. There are forms of immunotherapy that have started to be able to use the word cure when discussing treating cancer. And that's a very big deal. Now, to be specific, the medical term, like the definition of cure, with regards to cancer is a patient does not have a regrowth of that cancer. I believe it's for 4 years. So there's no reemergence, there's no setback for 4 years. I might be wrong on that, but I think it's 4 years. And so what they'll say in the clinic, if you come in and you have cancer again, in most situations, there's exceptions, but in most situations, that is a new form of cancer. So if you get beyond that 4-year benchmark and you haven't had any relapses, that's when we start using the word cure for whatever therapy that you used. CAR T-cell therapy is very new. So immunotherapy as a general concept is new, but the CAR T-cell therapy, I'm talking within like the last decade. And what it stands for is chimeric antigen receptor T-cell therapy. There's a lot of big words and a lot of medical jargon involved in that term, so I'm going to break it down a little bit. The reason that it is chimeric is because it is part T-cell, part antibody. And a chimera is a mythical creature from, I want to say, Greek mythology, but I might be wrong about that. Here, let me actually just look it up. Like chimera.
Yeah, you're right. Greek mythology, child of Typhoeus and Echidna.
There we go.
And sibling of Cerberus and the Lernaean Hydra.
Ooh.
No promises on any of that pronunciation. There's lots of A's and OE's that I'm not really totally clear on, but you're right on Greece. And I'm seeing lots of stuff about the 5-year cure. I was trying to fact check you on
5 years. Sure.
It might be 5 years.
Yeah, it might be 5 years. But a chimera, for those of you who have not read all of the Percy Jackson that we did, is a creature from Greek mythology that kind of like a griffin is like part lion, part goat, part dragon. It's a mixture of multiple different creatures. So it's called a chimeric antigen because it is a altered T cell that also has antibody activity. And that is a whole immunological tangent that I'm really not going to get into because the immune response is extremely complex and is, to be perfectly honest, not something that I'm particularly good at. But the thing that is important is that T cells and antibodies are both very important parts of the identification of pathogens and the destruction of pathogens. So antibodies bind to things in the body that are not supposed to be there, to tag them to be destroyed. And T cells are one of the cells in the body that go about destroying said things that shouldn't be in the body. And because, of course, the inherent problem with cancer and the reason that the therapies are so hard to tolerate is because we can't give you an antibiotic or an antiviral. We can't give you something that targets something that is non-human because the thing that is killing you is you. It's still your cells. They're just replicating in a fashion that they shouldn't be. And so it's really hard to target because if you give somebody a drug that targets their cells, of course it's going to hit everything else as well, and which is why we get those horrendous side effects because it's destroying your own tissue as well as the cancer. And so the reason that the CAR T-cell therapy strategy is so exciting is because there are certain proteins that have been found to be expressed by certain cancers that normal cells don't express. So there's a uniqueness to these cancer cells that you can actually target with these genetically altered T cells. And so they're altered in a lab. So they're taken from the patient who has cancer. You can extract T cells from your bloodstream. You isolate them in a lab, you add this antibody portion, and you make it so that they only respond to that one protein, which is not the way that a normal antibody or a normal T cell would behave. There would be, think of all of the diseases that we can get, all of the viruses and common colds that we have over our lives. You need to be able to recognize all of those. But we don't want the T cell to recognize anything other than cancer cells. And so you strip everything else away and you put just that antibody back, or that antibody back in that identifies just that singular protein in your cancer cells, and you reintroduce those cells into the patient. And so it acts as what is called a living drug, because there's no, it is you. It is a modified version of your cells that will float through your bloodstream, bind to the cancer cells that are expressing this unique protein, and destroy them and them only. And so that is a profound discovery that has wide sweeping implications for cancer treatment as we know it. At this time, CAR T cell therapy is only approved and used for types of blood cancer. So things like B cell leukemia or other types of blood cancers that you will hear of. And the reason for that is that it has proven to be difficult to get these CAR T cells to really dig into a tumor mass. And so, of course, if your tumors are circulating in your bloodstream like they would be with leukemia, because it's a cancer of the blood, then it's a much smaller overall masses, and the T cells respond to that better. But if you've got something like lung cancer, where you have a tumor in your lung, it's, the T cells can bind to the exterior of that mass, but it's difficult to get them to continue to attack it and shrink it. So that is still a work in progress. But CAR T cell therapy is actually FDA approved for a couple of these blood cancers. And the reason that it is so groundbreaking, first of all, is the specificity of it. And second of all, is there is a 30 to 40% chance that is a one-time treatment. Which means that you go into the hospital, they will take your blood, isolate your T cells, they will do this chimeric antigen receptor process where they add this antibody that's going to target the specific protein that they're looking for. They introduce those cells back into your body, and there is a 30 to 40% chance right now, of course we hope that gets better, that those cells will kill every single tumor cell in your body on the first try. There's no years of chemotherapy. There's no repeated radiation, both of which of those have horrible side effects. And the radiation can actually put you at risk of developing cancer later in life anyway, because you're blasting your body with radiation. And so and even the injectable immunotherapy drugs that we already have are not as effective and brief as that. The opportunity to leave the hospital cured of cancer is, it was unheard of up to this point. The issues come in with the safety of the treatment. And this is something that's continuing to be worked on and continuing to be developed. And this is by no means a concluded process, because this procedure and this therapy is so new. But part of what the immune system does, and we talked about this a little bit in the episode that I talked about allergies. So if you're watching at home and you're curious, you should go back and check that out as well. But one of the things that the immune system stimulates is inflammation. And so when you introduce those T cells back into your body, they respond to the cancer instantaneously, because that's what they're supposed to do. The problem with that is that they can initiate what's called a cytotoxic storm, because T cells, when they bind to things that they are supposed to kill, which happens in our body naturally all the time, that's not a new process, they release all sorts of chemicals into the cell itself and into the surrounding area that damage and destroy cells with the hopes of destroying that invading pathogen. But you can imagine that if that happens in the entirety of your bloodstream simultaneously, you can get a massive overload of those chemicals, which then will cause immense generalized cell death throughout the body, because the T cells are doing what they're supposed to, but they're doing it so well that it actually injures the body. And so that is a lot with what happens, or that's very similar to what happens with most immunodeficiency or immune disorders, but on absolute hyperdrive. So if you talk about like type 1 diabetes, that's the destruction of insulin releasing B cells in the pancreas by your own body's immune cells. But that takes place over the course of months or years, usually, as opposed to in, the hours following being injected with this medication. Well, not even, it's hard to say. You can't really call it a medication, right? Because it's your cells. It's not really a drug, it's you. But following being injected with this therapy, all of that can happen at the same time, and the massive extreme toxicity can actually kill the patient. Which of course is horrendous, but it also damages the validity of this as a therapy, because if we can't get it to be safe on a repeated level, it's just kind of like a roll of the dice when you go in, which I'm not saying that it is, but if it doesn't improve beyond that point, it's really hard to make this anything other than a last ditch effort. We've tried everything else, let's do this now therapy.
And that makes it, just to jump in quickly, that's when you have that sort of high risk, high reward structure to a treatment type, it's a big obstacle to development, because as a scientific community, at least on this side of the pond, things happen differently over in Europe, but we have never wanted to, sacrifice individuals in the development of a type of treatment. And so if you have, for clinical trials, if you say, yeah, this could kill you, that is going to develop and refine much more slowly. So which sort of stands to reason and should be that way.
Which is, like you said, there isn't anything wrong with that. It's just, this is such a promising therapy that chance of being in remission, being cured in one treatment is so profound. And there is evidence that this will work for, as far as we can tell, every type of cancer. We just haven't gotten it to work yet. It's just a matter of finding those unique proteins that are being expressed by each type of cancer and putting them on the T cells. So at the moment, it is approved by the FDA for treatments of certain different blood cancers, like the leukemia that I was talking about. I want to make that very clear. This is something that does happen. But it comes with a pretty substantial set of stipulations, which is that you have to have tried and failed 2 prior forms of therapy before you can even be considered for this procedure. Because it is still such a research project, it is still so risky, and it's extremely expensive. I want to make really clear that the technology for fusing an antibody to a T cell was not something that we just had bouncing around in the back of, your average chemistry lab. Like, this is really advanced, really complex, really delicate work that needs to be done. And there wasn't any like field guide, there wasn't a handbook where you could be like, yes, okay, well, now we've got the T cells, so we take the antibody and we go, and then you're good to go. It is an almost entirely novel procedure, which is incredible. I wish that I could tell you who was the mind behind the creation of CAR T-cell therapy. I'm looking at the Wikipedia over on my other screen here, because several of the articles that I had found prior to just going to the Wikipedia were from various clinics that perform CAR T-cell therapy. And so there was a bit of an incentive-laden spin to what they were writing, which I didn't really like. But I'm not seeing anything. Who created?
So what came up when I was looking was, and this is going to be pronounced poorly, but Zelig Eshar, an immunologist, and he's credited with developing the first CAR T cells at the Weizmann Institute of Science in Israel in the late 80s. And in 1990, they prepared CAR T cells that targeted human melanoma. But in terms of the modern cutting edge development, I'm not sure.
Yeah, so I'm seeing something similar. First CAR T cells were developed by Yoshikazu Kuwana et al., and then Gideon Gross and Zelig Eshar at the Weizmann Institute, which is what you just mentioned. But we are now in the 4th generation of CAR cells, depending on their composition. So, like I said, this is something that is still very much a developmental process. It's that we have definitely not reached a point where we're just ready to be done, and just use this as an everyday treatment for people with cancer. I think that the potential, which it's crazy to say something that was discovered, created, invented almost 40 years ago, is still working on potential, is immense. Because if we can solidify unique proteins that are expressed by each form of cancer, like I read in this brief Wikipedia read that I did, there is no reason that it can't work for everything. We just haven't figured it out yet, which is a really tantalizing and really uplifting prospect, I would say.
That's great. That's all definitely a little bit over my head, but I love the sound of "This Cures Cancer," as we all should. So, and so what I'm going to dive into with music therapy is definitely something I'm probably less knowledgeable about. It's tangential to my field, obviously the music part, but clinical music therapy is sort of its own burgeoning field that is being established and growing as we speak. And one of the first things I want to do is make this distinction between clinical music therapy and therapeutic music, which sounds very much like semantics, but the field of music therapy really wants to make this distinction, because all of these things that are potentially beneficial, like playing music for an Alzheimer's patient, or philanthropic music groups such as bedside musicians, sound healers, etc., that go into nursing homes and play music for, or hospitals and play music for patients. Those are all, powerful examples of therapeutic music practices,
Okay.
but clinical music therapy is distinct in that it's, the evidence-based music interventions by a therapeutic professional who is credentialed. And so they just like to make that distinction in that, you saying I want to play music for my grandmother with Alzheimer's is great and potentially beneficial, but not the same thing as someone in the field of music therapy with a tailored sort of set of procedures designed to address a specific patient's needs. So they push back against that a little bit.
Gotcha. Okay.
I definitely don't want to create any confusion about that. It is definitely there's to your point that you were making before we started this recording. There's definitely sort of a void of research and information in this particular field, which is part of why, and definitely more research is needed to sort of empirically categorize these trends that we see and how music can impact the cognitive function of patients and how it can be used as a pain mitigator. We sort of can anecdotally observe those things,
right.
But because the field officially is so new, there's not a ton of long-term studies and data to look at and say this is hard evidence that a clinically designed music therapy program can work in this way. And so that's part of why I think music therapy professionals feel the need to make that hard line distinction. They're like, no, this is this is something that we've tailored specifically and researched professionally, as opposed to just, yeah, my job is I go in and put on a playlist for old people, because then it's like, well, your job doesn't really need to exist. People could do that for their own family members as they're going through their healthcare needs. And so music therapy, it's an established health profession, and it's using music within a therapeutic relationship. And I would have thought largely that it was reliant on sort of the relaxation and emotional impact of listening to music, but they look at physical impacts, emotional, cognitive, and social needs of their patient through music treatment. And so those two examples that I mentioned before of sort of what music therapy is not, I'll now go ahead and go back and give their sort of, this is musictherapy.org, a lot of what I'm quoting from right now.
Okay.
And if you're interested in going and reading more about what they have to say. But so basically, music therapists have to have a bachelor's degree or higher in music therapy, and 1,200 hours of clinical training, which is a lot. Music therapists have to hold the MTBC credential through the Certification Board for Music Therapists, and it's a evidence-based health profession with a strong research foundation, and it does intertwine with the fields of psychology and medicine, and of course, generally music. And so they do stress that intersectionality. It's not that listening to music would ever be sort of, we're never going to treat cancer with music therapy, is what I would say. It's always going to be sort of that. And they're not trying to suggest that. That would be very much, an alternative form of medicine that doesn't really mix with our Western routines. And they definitely want to make that distinction, that this is coupled with more traditional sort of treatment programs for as a means of increasing cognitive or preserving cognitive function and pain mitigation. And so looking at that, we should think a little bit about chemically the way that music can impact our brain, and so
Yeah.
why that works. Especially people will think of Alzheimer's specifically as an example, and so there are sort of four big chemicals that you will probably be able to elaborate more on how they impact the brain. But we're thinking about dopamine, cortisol, serotonin, and oxytocin,
Okay.
and how music elicits a response in those four chemicals. And so dopamine is our brain's response. It's for reward, motivation, and pleasure. And so basically, since music is emotionally evocative, when we become emotionally engaged by music, there's that's a big word. Dopaminergic.
Dopaminergic.
Yeah, thank you. Dopaminergic neurotransmission.
Yep.
With reinforced stimuli by the musical experience. And so we have sort of the data on this through looking at brain scans. Simply listening to music has so there are lower requirements for opiate drugs in post-operative pain and other medical treatments when listening to music. And music can stimulate the release of endogenous opioid peptides within the brain. And so that's really cool, just in terms of pain management, that there's sort of an enhancer to the effects of opiates, and always keeping the dosing low on opiate pain medication is preferable, because we've sort of seen the impacts of overprescribing opiate drugs for post-operative care. And so that's sort of a big deal in and of itself, just on that point. And we still have 3 other chemicals to talk about, so oh boy.
I wonder if they I won't put you on the spot and be like, hey, what do you have to say about this? But dopamine is involved in the degeneration involved with Parkinson's. Specifically, Parkinson's is when the cells in your brain that are supposed to make dopamine don't make it as good as they should. That was a horrendous sentence.
As good as they should.
And so I would be curious if that would be a really difficult study to do. But just
I think I know I have an article in here somewhere that mentioned Parkinson's.
It wouldn't surprise me.
Trying to think.
I'll say while he's looking that dopamine, cortisol, serotonin, and what was the last one that you said?
Dopamine, cortisol, serotonin, and oxytocin.
And oxytocin, yeah, are 4 of the most important chemicals in the brain and in the body at large. A lot of anxiety and depression-based disorders are due to a lack of serotonin. There's numerous medications that attempt to raise the serotonin levels in the body in people experiencing chronic depression or anxiety-based disorders. And so just to sort of add credence to what they're saying, if you can improve the basal levels of those chemicals in somebody's body, all of that is good.
Yeah, absolutely. So this article that I had pulled up is not quite as solid of an answer to your point about Parkinson's. I was like, ooh, yeah, that's perfect, because its title is it's sort of quote under the title is researchers are exploring how music therapy can improve health outcomes among a variety of patient populations, including premature infants, people with depression, and Parkinson's disease. And so I thought at some point they would talk specifically about Parkinson's, and they kind of don't.
That's okay. So, you keep talking, and I'll do a little side research here.
Aha! Now I found it. Okay. Let's talk about Parkinson's for a minute. Quick aside. So researchers are exploring whether sound vibrations absorbed through the body can help ease the symptoms of Parkinson's disease, fibromyalgia, and depression. So that's a specific sort of subcategory of music therapy that's vibroacoustic therapy.
Wow.
Involving low frequency sound, so it's sort of like a white noise rumble, to produce vibrations that are applied to the body directly. So you would have the patient lying in a chair while speakers are transmitting vibrations that can be heard and felt. And so with that, with microacoustic therapy for Parkinson's patients, there was, and it just says, improvements in symptoms, including less rigidity and better walking speed, and reduced tremors. So 40 Parkinson's patients in this study were exposed to low frequency vibration for 1 minute, followed by a 1 minute break. And then they alternated the two for a total of 10 minutes. And so they're planning on doing a long-term study with microacoustic therapy. This is at the University of Toronto's Music and Health Research Collaboratory. All this coming from apa.org. The American Psychological Association, an article called Music as Medicine by Amy Novotny. Sorry if I'm saying your name wrong, but just wanted to give credit. So that's sort of their little spiel on how they're treating Parkinson's. They didn't mention the chemical breakdown specifically in that one, but they're gathering more long-term data on how that type of treatment can mitigate symptoms from Parkinson's specifically, which is cool. I would imagine the practical tie-in does in some way correlate to what you were talking about how those chemicals function in our brain. So going back to that other article that I had, there it is. So the other chemicals that are sort of the big ticket items with music therapy, cortisol, serotonin, and oxytocin. They're all a little bit more brief than dopamine, but cortisol is a stress hormone. Mm-hmm. And so that gets into the relaxing, stress mitigating effects of listening to music. And so basically listening to relaxing music just alleviates cortisol secretion. And so if you're operating at a high level of stress, which many late in life care patients do baseline, then that can be a big deal in just a quality of life setting. Yeah. And also there are lots of studies on the long-term effects of high levels of stress. And so
none of it is good.
Any of us, yeah, our bodies are very well designed for handling short bursts of extreme stress,
right,
and then getting back to those lower cortisol levels. But the long-term high level of stress is just harmful in everything in our body, and so that's, sort of universally applicable. But as soon as I pull back into that, then I'm talking about therapeutic music as opposed to music, as opposed to
teetering on the edge there.
Yeah, exactly. And I will sort of make that transition in a little bit. Am I doing on time? How long have I been talking for?
We're fine. We're at like 43 minutes.
Okay, perfect. So I have a little bit more time. So I'll try and get there. And then serotonin is another sort of happy chemical, plays a role in happiness. Talk about I'm just need that one molecule of serotonin in my brain to get started in the morning. And so lower serotonin levels, that's when we're looking at anxiety, depression, low self-esteem, irritability, all pretty common side effects of being at an advanced age and battling cognitive impairment as a result of Alzheimer's or Parkinson's. And so making our patients feel good can often be an underrated form of treatment. Mm-hmm. And finally, oxytocin operates with stress response systems and cardiovascular regulation. So having low levels of oxytocin can tie in with pain and anxiety. Mm-hmm. And so increasing the rate of production of oxytoxin was what I was going to say. Oxytocin can decrease anger, fatigue, anxiety, and pain. And so listening to pleasurable music can significantly increase levels of oxytocin and self-reported levels of relaxation in post-surgery patients. So most of what we're looking at are for the purposes, that wasn't a good grammatic sentence. The purposes are mostly for pain mitigation and, as I said, patients with cognitive impairment. But there's also tie-ins that I don't quite have time to get to because I want to talk a little bit more about therapeutic music for people who aren't in those medical situations. But there are tie-ins for autism, children with autism, of course, dementia and Alzheimer's, and generally increasing motor skills of those with cognitive challenges. And so there's lots of research that needs to be done to sort of empirically reinforce that data, but we've seen through working with patients, and I wouldn't want to say that there's no research because that's sort of a big point on the What is Music Therapy APA website that I had pulled up, was that this is a research-based field. It's not just all, good feelings. I like to play music for my Alzheimer's patient because it makes them happy. There is a basis and list of clinical procedures, and I don't want to discredit that, but basically every article says we've seen this reduction in a small sample by percentage, and we need to increase that sample size and the variety of patient pools that we're working with so that we can confirm the validity of those findings. So basically,
always want more data.
Exactly. So the fact that we want more data doesn't discredit the treatment patterns that music therapy professionals have now are also evidence-based. It's just that this is a burgeoning field and we need to continue to gather more information.
And I really just want to briefly underline how important the mitigation of pain is in post-operative treatment of patients, because part of the reason that the opioid crisis exists right now is because there was all of this research that was done that says if you reduce the pain levels in patients who either have chronic illnesses or are coming out of surgery, particularly in those who just had surgery, they recover faster because they're in less pain. And so people got prescribed opioids for their post-operative pain because we thought that it was going to make them get better faster, but it instead has just gotten all of these people addicted to opioids. And so I cannot state enough how important it would be for music therapy for pain mitigation to get a little bit more traction as an alternative or a subsidiary of that type of therapy as a way that we could help combat the opioid crisis.
Right. And I think that's the probably the most practical view is of music therapy as a subsidiary. So maybe we can reduce the dosage of our opiate painkillers if we're coupling that with a music therapy treatment that lowers our pain thresholds long term. And so I did want to talk a little bit about, because the majority of us are not in post-operative care, we don't have Alzheimer's or Parkinson's. And so how is music therapy still relevant to you? And of course, that ties in a little bit more to the therapeutic music, or what I would call music as self-care, which is also perfectly relevant because a lot of these hormone imbalances in the brain are also tied to anxiety and depression, which are widespread in any age demographic, and so it's not just an old people problem by any means. And so when we're talking about music as self-care, of course that ties in also to, separate from brain function, but just increasing our dopamine levels is a kick. It's a feel-good hormone, and so people have done sort of unknowingly therapeutic music for themselves for a long time. It's like, I just want to jam out in my car and get that little dopamine kick, and that's actually supported by research, and so that's interesting to think about. But also, I don't know that I'd heard this phrase this way before, and this is a Tend Academy article written by a music therapist, so I'll give her some credit as well. But she says that music is intimately tied to emotional memory. And so the feeling of being transported back in time when you hear a particular song, that is sort of supported by the research in the field. And so a lot of times I think, and I'll make a claim that is not supported by research, but I think that, that using music as a way to fully experience our emotions is especially important in sort of the hustle and bustle and emotional numbness that is sort of running rampant in our society today. And so using basically music as a tool to reconnect us with our humanity. That's sort of where that comes back in with self-care. Let me know if I start running over time. I'm just going to run through
We're at
these
50
last.
minutes right now. We got a couple things that we're going to cut out, so you do you.
Okay, perfect. So this last little bit, I just wanted to, she gives some tips for using music as self-care. And so you can calm your nerves by listening to music with a slower tempo between like somewhere around your average resting heart rate. And so that sort of ties in with your physical experience, but can produce a calming effect emotionally, using music in certain playlists to process difficult emotions. And of course, the psychological benefits of being involved and making music cannot be understated as well. As a musician, I love that. I love that she includes that. Music positively impacts our mood, self-esteem, cognitive function, and she claims that musicians have bigger brains. I'm guessing that's a slightly manipulative,
I hope
might
not,
be true
because
statement.
Our cranium is only so big.
Yeah, but so basically, this is coming from a music therapist, and she's saying, you don't have to be a post-op care patient to be using some of these strategies, and certainly as just everyone dealing with the emotional stress of the way the world is right now. Hopefully things will be a little bit better when this podcast is coming out, but it certainly can't be understated the role that music can have and the positive impacts of that psychologically. So every musician and most people who just enjoy music probably already know that, but just wanted to throw it out there that is in fact supported by research.
Well, and it's cool to hear that there's an empirical justification for the way that people have felt for thousands of years. There is some evidence that suggests that doing things like singing in a choir can actually help prevent some of those degenerative mental diseases such as dementia and Alzheimer's that happen later in life, as well as being used as a therapy if they do occur. So singing in a healthy space, there's almost nothing bad about it. I guess the only thing that would be bad about it is if it isn't a healthy space.
Right, exactly. Yeah. So, of course, the benefits of group music making might feel like a little bit of a twist in the knife in the current situation.
Face at the moment.
Yeah, exactly. But even still, the quality of the music making in terms of psychological benefit is pretty much irrelevant. It's purely the participatory nature. So it doesn't really matter if you can't carry a tune. Singing along to the radio still can give you a psychological boost, an emotional boost. And so I would definitely encourage participatory music making in a safe, social distanced setting. Wear your masks.
Well, cool. We're at about 55 minutes. So I think we're probably square. I always forget to say this at the top of the podcast, so I'll say it now. In particular with some of the stuff that I'm talking about, that is extremely advanced and complicated therapeutically. This podcast is called Underqualified for a reason. We're talking about things that we are interested in because we are interested in them. By no means are we experts in anything that we are talking about. And so we say that our 3 rules are that we will do everything in our power to only say things that are true to the best of our knowledge. If you are somebody who happens to know more about these topics than what we have currently said, if you have more to add, if we said things that are incorrect, we highly encourage you to participate. Reach out in the comment section of this video and tell us either some more about what you are working on or what we did wrong. And the third and final rule is just be nice, because we're doing our best to talk about things that we care about, and we hope that you guys care about them too.
we really appreciate all of you who stopped by. We hope that you are all hanging in there as best you can in the world that we are currently in. Any and all politics aside, I think we can all agree that it's difficult to just be out and about these days. So we wish you all well. And like Benjamin said, turn the radio up a little bit next time you're driving somewhere, and let the happy chemicals flow.
Oh yeah, that dopamine kick. That's gonna get you through all this. So thanks for hanging with us, everybody. We'll see you next time.
Take care, y'all.